Okay, can everybody hear me? Okay, bom dia. I didn't realize I didn't have a podium. I'm comfortable sitting down. I hope everyone else is as well. Today, for about 40 minutes or so, we're going to talk about the assessment and management of delirium in hospitalized patients. So I hope you're in the right talk. A few quick words why we need, I think, discussion about this topic. And the first thing is that it's a very common medical condition. If you work in the hospital and take care of medical patients, you will see delirium very frequently. And sometimes it's misdiagnosed. And as far as the incidence or how often it occurs, it really depends upon the patient population. When you talk about that, it's hard to give an overall statistic because in older patients it's more common. In post-surgical patients it's more common. In patients with underlying CNS disease it's more common. So we'll talk about these conditions, but to give an overall incidence is highly variable. There's a significant morbidity and mortality associated with delirium as well. The mortality at 1 and 6 months is 14 and 22%, as you can see. And the thing is, even if it's reversible, even if you are able to fix the problem and treat the patient's condition, delirium is a marker for bad things to follow. When someone becomes delirious in the hospital, it should raise a red flag or an alarm to you, even if they improve, that this person is potentially going to have problems in the future. And that's a very important concept because patients who do develop delirium, they do over time not as well as patients who don't have this problem in the hospital. So other things as well, when a patient gets delirious, as you may know, it increases your medical expenditures. This is an unplanned thing that happened to somebody in the hospital. When this happens, now all of a sudden the length of stay increases and it costs more money to be able to take care of that patient in the hospital. It's certainly treatable and it can be prevented to some extent, perhaps, and we'll talk about that. So the outline for the next 30 minutes or so will be to discuss a case, talk about how to make the diagnosis.